won't stop hurting. Dr. Jake Berman, Berman Physical Therapy here again. One of the most common things that we hear other than back pain is knee pain. Knee pain is one of the most common causes for people to slow down, to stop doing the things that they love to do, whether it's running, golfing, playing tennis, or even getting down on the ground playing with their grandkids. Doesn't matter what it is, knee pain can be severely debilitating. So common questions are, why is there this sharp pain in the front of my knee? Why does my knee feel like it's just going to buckle or give way? Why did my friend's knee get better and mine hasn't? Why is this taking so long? Am I going to have a knee replacement? These are all very common causes or concerns that we hear frequently in here, and we need to address them now. There's two main causes to knee pain. One of them, the most common cause that we see, is hip weakness. So the glute medius is the most problematic muscle that we run into here for back pain, knee pain, doesn't matter. Because when this hip muscle is weak, the glute medius, when you go to step forward and pick this leg up off the ground, if this muscle is weak here, the hip will fall out. When the hip falls out, it pushes all this stress through the inside of the knee joint, will help speed up the rate at which it deteriorates, degenerates. Arthritis, degenerative knee replacement, very scary terms, but very preventable, or at least slow them down. The other thing is not having full knee extension. So the knee has to be able to go into full extension. If we lose that full extension, there's increased compressive forces on the knee joint. Not good. Helps increase the rate at which the knee degenerates, causes pain. Those are the two most common causes that need to be addressed, or you will continue having knee pain. It's not going to get better, and the world's going to end. No!